This dental minute video is about tongue ties. How do I know if I have a tongue tie? Well, if we lift up our tongue and look under our tongue, there's like a fleshy little string of material there. Kind of looks like this. This is a normal position for the lingual frenum, which is that muscular attachment that attaches our tongue to the floor of our mouth. Now, when somebody has an anterior tongue tie, it looks more like this. Very restricted in every type of movement. If we have a posterior tongue tie, it looks more like this. These are a lot harder to diagnose and commonly go undiagnosed. So who cares? What's the relevance? Well, as children, if we have any type of tongue tie, think of this. The tongue is the biggest muscle in our mouth. And if it's not sitting in the right place, it doesn't allow our dental arches, our jaws, to develop properly. So we get these narrow or V-shaped constricted jaw arches, right? Then our teeth come in crooked as well. As an adult, this stays relevant to us not only because we have a bad bite or malocclusion, but it can also make us start suffering from temporomandibular disorder of the jaw joint. It can give us headaches. It can make us snore or suffer from obstructive sleep apnea. It could cause a lot of different issues because the tongue posture is relevant to how this whole area functions. We want balance, and if things are not in a balanced position, it causes some kind of problem. So many people walk around with pain and think that all that shoulder and neck tension they have is normal and snoring is just part of getting older or getting heavier. That may be the case, but that's not always the case. If you look in your mouth and you think that you may be tongue-tied, ask a qualified dentist who knows how to look for these things to check for you. Now, if you're tongue-tied, how do you fix it? Because it is very fixable, but you got to do it right. First thing you have to do is find a good myofunctional therapist. That's like a personal trainer for your tongue. They teach you tongue exercises that you can do in your own home every day to get the muscle strong because, again, the tongue is a muscle, right? And so is that attachment underneath it. So we want to prepare that whole area for the surgery. The surgery is rather simple. It's usually done with a laser, sometimes with a scalpel, and it's just to release the muscle. And right after the surgery is performed, you want to continue those tongue exercises so things don't reattach and want to go back to that, that unbalanced position causing all these issues. I hope that was helpful. Now we know a little bit more about tongues. How do you swallow?